Good afternoon, all. So now I am going to take a topic on poisoning. So let me see the introduction first. A poison is any substance that when ingested or inhaled or absorbed or anything which is applied to the skin or produced within the body, it is relatively a small amount or a big amount or it will injures the body by its chemical action. So the branch of medicine that deals with the detection and treatment of poison, it is also known as the toxicology. So let me see the definition of the poisoning. A poison is any chemical that harms the body. It is more than 5 million human poisonings occurs each year in United States. Poisoning can be accidental or occupational, recreational, or maybe intentional. Natural or manufactured toxins can be ingested, inhaled, injected, splashed in the eyes or any other orifice, or absorbed through the skin. Poisonings, it is related to the use of illegal drugs also. It may be amphetamines, opioids, and hallucinogens. It is also due to toxic plants also or any contaminated foods. So which causes the poisoning to the human beings. So let me see the epidemiology of the poisoning. According to World Health Organization data, in 2012, an estimated 1,93,460 people who died worldwide from unintentional poisoning. So out of these deaths, 84% occurred in low and middle income countries. So in the same year of 2012, unintentional poisoning caused the loss of over, that is more than 10.7 million population per year of healthy life, that is disability adjusted life years. So that is more than 10.7 million people were died because of the unintentional poisoning. So next to see the acute pesticides poisoning is one of the most common cause of intentional deaths worldwide. So, but in India, National Crime Bureau of India has reported in accidental deaths and also suicides in India by the year 2015 is 26,173 people were died because of poisoning by the year 2015. So sorry. Emergency treatment is initiated with the following goals for the poisoning. So first goal of the management and the emergency treatment for the poisoning is to remove or inactivate the poison before it is absorbed through the skin or any other things, and to provide the supportive care in maintaining the vital organ system. So it should not be injure any organs because of the poisoning. To administer a specific antidote to neutralize a specific poison, and the last goal is to implement the treatment that hastens the elimination of the absorbed poisoning. So what are the types of poisoning? So first will be the ingestion poisoning, and second is the inhalation poisoning, and third one is the injection poisoning, and fourth is the absorption. Through the absorption, there will be a poisoning. So the effect of poisoning may be a local, systemic, or both. May be a local and also the systemic. It may occur immediately or several hours or even more days after the exposure. So what is the causes? Main causes of the poisoning is through the chemicals, household things like example bleach or the kerosene oil, and industrial things example is methanol, ethylene glycol, cyanide, arsenic poisoning, and pesticides we can see the examples like organophosphates, organochlorines, and rat poisons. And therapeutic drug overdose, it may be due to the drugs which may causes the poisoning to the person. So example is paracetamol, aspirin, iron tablets, nifedipine, and phenobarbital. So and the toxic plants also which causes the poisoning to the humans. So examples of toxic plants is poisonous mushrooms and toxic herbal preparation which can lead to the poisoning to the people. And last thing is the bites and stings of venomous animals. Example is snakes, scorpions, bees, spiders, and also the aquatic animals. So these are all the main causes of the poisoning. So what is the main symptoms of the poisoning which leads to the most of the people is getting the symptoms. So immediately when the injected the poisoning is into the person. So example like symptoms of the poisoning is vomiting, diarrhea, upper abdominal pain, difficulty breathing, palpitations, skin rashes, and scanty urine. So this is the common symptoms of the poisoning. So what is the another signs and symptoms of the signs of the poisoning of humans is fever, vomiting, diarrhea, dehydration, jaundice, tongue discoloration, unusual fever like smell or breath, and bad smell when the patient is breath, and changes in breathing rate or irregularity, and changes in pulse rate or regularity, and skin lesions may be there. Abdominal tenderness, changes in the pupil size, it may be a small or enlarged, and maybe a patient may have the seizures. And what is the main danger signs of the poisoning is when the patient is not having a breathing. So that is a no breathing. Patient may have the breathing that may be a wheezy or noisy, and pulse below 50 or above 110 beats per minute. That will be a irregular like pulse rate or the very weak pulse rate. And non-reacting pupils, loss of consciousness, continuous seizures will be there, and temperature more than 39 degrees Celsius if we take the oral temperature or the rectal temperature. In case if we are taking the temperature through the axillary, so it may be a 38 degrees Celsius. So, and also the patient may have the severe abdominal tenderness and the anuria. So these are all the danger signs the patient has to rescue through the team. So what are the investigations we should perform to the patient in case of patient with poisoning? So first is the TLC and blood urea nitrogen and creatinine, electrolyte levels, liver function test, fasting blood glucose we should check, and toxicological analysis of identified substance or tissue samples. Like example is gastric aspirate when the patient is having the ingested poisoning. And what is the treatment and the important objective or the goal of the treatment is to maintain the normal vital signs. The patient should have the normal temperature, pulse, respiration, and also the blood pressure. So our first goal is to maintain the normal vital signs and to decontaminate the site of exposure. We should eliminate the poison where it is. So we should decontaminate the site of exposure, and we should prevent and reduce the absorption to the vital organs, and to enhance the elimination and to relieve the main symptoms from the patient, and to prevent the further organ damage or impairment without delay, we should rescue the patient. And what are the non-pharmacological treatment for the poisoning? So first, we should ensure the airways should be patterned and remove the contaminated clothings if necessary. So wash the chemical away from the skin with soap and lot of water. If necessary, we can perform the nasogastric aspiration if airway is protected. Carry out the gastric lavage and aspiration within the first 1 hour after the event or the later. If it is involves slow release or highly toxic substances, we should do the gastric lavage. Retain the patient in the clinic or hospital for close and continuous observation, re-evaluation, and supportive and symptomatic treatment. What is the treatment? So according to the treatment, we should do the treatment and carry over the treatment and maintain and continuously monitor the patient's vital signs. And what is the initial management is for the hypoglycemia? If the patient is having the hypoglycemia, we should inject the IV glucose 25 to 50 ml of 50% over 1 to 3 minutes. We should administer the glucose. For the opioid overdose, we can administer the naloxone IV. So for the adult, the dosage is different. For the children, the dosage is different. So for the adult, 0.4 to 2 mg, we should repeat every 2 to 3 minutes. That is maximum we can give 10 mg. So for the children's 10 micrograms per kg start dose, subsequent dose of 100 micrograms per kg. If no response, we can start the initial dose. If the baby is not having the response, we can start with the dose. And then naloxone subcutaneous or IM can be given if when the patient is not react to the IV, or if the IV route is not feasible, we can give the subcutaneous route or the IM route. So what are the antidotes we can give for the poisoning is, we can use 5 to 10% because of less availability. So according to WHO, antidote is defined as the therapeutic substances used to counteract the toxic actions of a specific xenobiotics. So when we give the supportive therapy and also with the correct antidote, we can save the patient and patient will be surviving. And what are the physical antidotes we can give for the poisoning? So agent used to interfere with poison through the physical properties, not change their nature. So in case of absorbing, so the main example is activated charcoal we can use as a physical antidote. In case of coating, a mixture of egg and milk make a coat over the mucosa. And dissolving, we can use 10% alcohol or glycine for the carbolic acid. So in case of ingested poisoning, if the baby or any other persons which is poisoning is because of the ingestion or the swallowed anything poisonous substances, that is called as the ingested poisoning. So swallowed poisons may be a corrosive. So corrosive poisons include the alkaline and also the acid agents that can cause the tissue destruction after coming in contact with the mucous membrane. And alkaline products example includes like a dry cleaners, toilet bowl cleaners, bleach, non-phosphatase detergents, oven cleaners, and button batteries, like batteries used to power watches, calculators, or the cameras. Acid products including the toilet bowl cleaner, pool cleaner, metal cleaners, rust removers, and also the battery acids. So petroleum distillates and hydrocarbons example is kerosene or turpentine, and drug overdose is also a poisoning, and food poisoning. So these are all the things which can be ingested poisoning. So which is important thing. And what is the management of ingested poisoning is which should check and maintain the ABC, that is a airway breathing and also the circulation. We should immediately take the ECG and assess the neurological status of the patient and give water or milk to drink for dilution of strong acid. In case patient had a acid or the any alkaline poisoning, we should give the water and milk. And next is a gastric emptying procedure. So syrup of ipecac to induce vomiting in the alert patient. So never use with the corrosive poison. So gastric lavage for the abandoned patient, gastric aspirate is saved and sent to the laboratory for the testing. What is the toxic agents the patient has ingested? So we should observe for that. And activated charcoal administration can be given. So that is 1 gram per kg. So cathartic when appropriate, that is sorbitol, we can give 1 to 2 grams per kg. Sodium sulfate and magnesium citrate. So these are all the things we can use as a gastric lavage. So if there is a specific antidote, then administer it is as early as possible to save the life of the patient. If antidote is not available, then remove the ingested material by administration of the charcoal, dialysis or hemoperfusion. So what do you mean by hemoperfusion? So it involves the detoxification of the blood by processing it through an extracorporeal circuit or an absorbent cartridge containing a charcoal or resin, after which clean blood is returned to the patient. So that is like a dialysis. So we should perform it as early as possible. In case we are not having the antidote in hand, we can go for this. And next, second poisoning is the carbon monoxide poisoning, that is through the inhalation method and types. And carbon monoxide poison may occur as a result of industrial or household incidents or the attempted suicide. Carbon monoxide bound HB called that carboxyhemoglobin. So that does not transport the oxygen throughout the body. So it is very dangerous to the health of the person. So carbon monoxide exerts into the toxic. So it affects by binding to circulating HB and also it reducing the oxygen carrying capacity of the blood. So HB absorbs the carbon monoxide 200 times more rapidly than the oxygen. The patient go for the hypoxemia. So what is the signs of carbon monoxide poisoning? So exact signs of the carbon monoxide poisoning is the headaches, nausea, dizziness, breathlessness, collapse, and the loss of consciousness. So these are the signs of carbon monoxide poisoning. So what is the symptoms or the clinical manifestations of carbon monoxide poisoning? So first will be the headache, muscle weakness, palpitation, dizziness, confusion, progress towards coma, skin color blue, and a false reading of pulse oximetry. So because of the low oxygen content in the blood, and more amount of carbon monoxide, the skin color will be changed as a blue color. And what is the goal? What is the treatment goal is to reverse cerebral and myocardial hypoxia. So what is the nursing intervention is to carry the patient to fresh air immediately and open all the doors and also the windows to have the normal breathing and loosen all the tight clothings, initiate the cardiopulmonary resuscitation if required, and administer the oxygen 100% of oxygen, and we should monitor it through the pulse oximetry and prevent chilling. So we can wrap the patient in the blanket and keep the patient as quiet as possible. To not give alcohol in any form or permit the patient to smoke. So these are all the interventions. So next poisoning is the skin contamination poisoning. So that is exposure type. So skin contamination injuries from exposure to chemicals are challenging because of large number of possible offending agents with diverse actions and also the metabolic effects. The severity of a chemical burns is determined by the mechanism of action and the penetrating strength and concentration and the amount and duration of exposure of the skin to the chemical. So what is the goal of this treatment is to prevent the skin from the exposure. So what is the intervention for the exposure, contamination or poisoning? So wash the exposed skin thoroughly with the water, and water should not be applied to the burns from lye or white phosphorus because of the potential for an explosion or for deepening of the burns. All evidence of these chemicals should be brushed off the patient before any flushing occurs. Start with standard burn treatment according to the size and also location of the wound. So antimicrobial treatment we can give, debridement of the wound, and tetanus prophylaxis we can give. Antidote administration can be prescribed as per the doctor's order. So plastic surgery may be required for the further management of the wound if the wound is very severe. And the next fourth type of the poisoning is the organophosphorus poisoning. So it is organophosphate compounds or a diverse group of chemicals used in both domestic and industrial settings. It can be one of the important organopoisoning. So what is the pathophysiology of organophosphorus poisoning is the primary mechanism of action of organophosphate pesticides is inhibition of acetylcholinesterase. So acetylcholinesterase is an enzyme that degrades the neurotransmitter acetylcholine. So that is into the choline and also the acetic acid. So acetylcholine is found in the central and also the peripheral nervous system, neuromuscular junctions, and also in the red blood cells, that is RBCs. So organophosphates inactivate the acetylcholinesterase by phosphorylations. So once acetylcholinesterase has been inactivated, acetylcholine accumulates throughout the body system and resulting in overstimulation of muscarinic and nicotinic receptors. So clinical effects of manifest via activation of the autonomic and central nervous system and at nicotinic receptors on skeletal muscles that leads to organophosphates can be absorbed cutaneously, ingested, inhaled, and also injected. So although most patients rapidly become symptomatic, the onset and severity of symptoms depends upon the specific compound, amount, route of exposure, and the rate of metabolic degradation. So what is the signs and symptoms of organophosphate poisoning is? It can be classified into three broad categories. So first will be the muscarinic effects. So what are the symptoms of muscarinic effects is excessive sweating, meiosis, bronchoria or the spasm, bradycardia, and also the hypotension if the patient had the organophosphorus poisoning. So first category of signs is the muscarinic effects. So next will be the nicotinic effects and also the central nervous system effects. So what are these signs of muscarinic effects of organophosphates is? So we can have the mnemonics. So first will be the sludge and second will be the dumbbells. So sludge, that is S for salivation, L for lacrimation, U for urination, D for diarrhea, and G for GA upset, and E for emesis. So in the dumbbells mnemonics, so D means that is a diaphoresis and diarrhea, and U means urination, and M stands for meiosis, and B stands for bradycardia, bronchospasm, and E stands for emesis, and another E for excess lacrimation, and another S for the salivation. And nicotinic second classification or the category of signs of poisoning is nicotinic signs and symptoms. So in that first symptom will be the muscle fasciculations, cramping and weakness of the muscles, and diaphragmatic failure. So autonomic nicotinic effects includes the hypertension, tachycardia, mydriasis, and the patient looks paler. And CNS effects, that is the third category of signs and symptoms of organophosphorus poisoning. So first will be the anxiety, emotional ability, and restlessness, confusion, ataxia, tremors, seizures, and also the coma. So what is the medical care we should give for the poisoning, that too in the organophosphorus poisoning? So first will be the airway control and adequate oxygenation we should give. That is the important thing for the to save the life of the patient in case of patient with organophosphorus poisoning. And we can go for the intubation if it is necessary in case of respiration failure or the respiratory distress because of laryngospasm, bronchospasm, bronchoria, and also in case of patient with seizures. So immediate aggressive use of atropine medicine can be used to eliminate the need for intubation. So succinylcholine should be avoided because it is degraded by acetylcholinesterase and may result in prolonged paralysis. And what are the medication we should use for the organophosphorus poisoning is that includes the atropine, tralidoxin, and diazepam. So what is the initial management must focuses on adequate use of atropine. So we should optimizing the oxygenation prior to the use of atropine, which is important, and also it is recommended to minimize the potential for dysarrhythmias. And we can use the anticholinergic agents. So these agents acts as competitive antagonists at the muscarinic cholinergic receptors in both the central and also in the peripheral nervous system. So these agents do not affect the nicotinic effects. Only we are concentrating only on the first thing. So first medicine is atropine. So for the adult dosage is 1 to 2 mg IV bolus route and repeat 1 to 5 minutes for desired effects like a drying of pulmonary secretions and adequate oxygenation. Strongly consider doubling each subsequent dose for rapid control of patients in case of patient with severe respiratory distress. So for the pediatric, dosage will be different. So in case of pediatric babies with the organophosphorus poisoning, so we can administer the atropine in the dose of 0.05 mg per kg IV and repeat 1 to 5 minutes for the control of airway secretions. So strongly consider doubling each subsequent dose to rapidly stabilize patients with a severe respiratory distress. So fifth poisoning is the snake bite and its management. So worldwide, while reliable data are hard to obtain, it is estimated about 5 million snake bites occur each year, resulting in up to 2.5 million envenomings, at least 1 lakh deaths, and around 3 times as many amputations and other permanent disabilities is happening. And in India, the peak incidence of snake bite cases is reported during the paddy sowing and harvesting periods, that is from the June to November. National Crime Bureau of India has reported in accidental deaths and also suicides in India by the 2015. According to this statement, 8,554 deaths occur because of snake bites in India by the year 2015. So next will be the classifications of the poisoning. So that is the snake bites. In India, poisonous snakes belongs to 3 broad families. So first category will be the Elapidia, and that includes the cobras and riots, and Viperidae, that is a vipers, Russell's viper, and saw-scaled viper and pit viper. And third category is the Hydrophidae, and that is the sea snakes. Poisonous snakes can be identified by their characteristics morphology. So poisonous snakes belongs to 3 families on the basis of poison secreted. So first will be the Elapidae. So that is a neurotoxic. So second classification is a Viperidae, that is a vasculotoxic. And third category will be the Hydrophidae, that is a myotoxic. So what are the local symptoms and the signs in the bitten part? So first is the fang marks, local pain, local bleeding, bruising, lymphangitis, lymph node enlargement, inflammation, that is a swelling, redness, and also heat, that is a warmness over the bite area, and blistering, local infection, abscess formation, and also necrosis, that is a cell death. So what are the general symptoms of these snake biters? So in the central nervous system, the patient may have the dizziness, fainting, increased thirst, and also the headache. So in systemic, the patient may have the fever and severe pain. And in respiratory system, the patient may have the breathing difficulty. And at the wound side, we can see the bleeding, fang marks, discoloration, burning sensation, and swelling. And other skin sides like bleeding spots, numbness, tingling, and also sweating. In the vision, blurriness, and heart and vessels, we can see the rapid pulse, low blood pressure, and severe shock. And muscular system, the patient may have the convulsion, loss of coordination, and weakness. And in the gastric system, the patient may have the nausea and vomiting. and intestinal, the patient may have the diarrhea. So these are all the general symptoms of the snake bite. So what is the initial first aid management for the snake bite? So that is right. That is R stands for reassure the patient. First, we should reassure the patient when once the has the snake bite. So 70% of all snake bites are from non-venomous species. So only 50% of bites by venomous species actually involvate the patient. So I stands for immobilize in the same way as we are in the fractured limbs. So we can use the bandages or cloths to hold the splints, not to block the blood supply, and we should apply gentle pressure and do not apply any compression in the form of light ligatures. They don't work and can be dangerous also. So GH that stands to, so that is get to hospital immediately. We should shift the patient from the area so to the hospital immediately. That is, the traditional remedies have no proven benefit in treating the snake bites. And T stands for tell the doctors of any systemic symptoms such as toxis that manifest on the way to the hospital. So this is the first aid for the snake bite poisoning, that is a right mnemonics. So snake bite treatment protocol is patient assessment phase. That is on arrival. So first we should deal with any life-threatening symptoms on presentation like airway, breathing and circulation. We should monitor and go for the treatment and the management. If there is evidence of bite where the skin has been broken, give tetanus toxin. So routine use of antibiotic is not necessary, although it should be considered if there is an evidence of cellulitis or necrosis, we can use for the antibiotics. So next is the specific treatment is polyvalent antivenin. So it is available in the lyophilized form. That is a liquid antivenin is unstable at room temperature. So we can active against the four common poison snakes in India like cobra, kite, Russell's viper and saw-scaled viper. So average potency of the anti-serum available in the is that 1 ml or 1 ml will be neutralized. That is 0.6 mg for the cobra snake bite and 0.4 mg for the kite. 0.6 mg is Russell's viper and 0.45 mg for saw-scaled viper venom. So reconstitution involves the addition of 10 ml of distilled water to an ampule and shaking till the solution is clear, and it should be administered intravenously as early as possible. It is essential to inquire about the allergy. If the patient is having any allergy, it is well to be prepared for an anaphylactic reaction during the antivenom administration. So what is the specific treatment is standard high dose, that is loading dose of 100 ml followed by 50 ml every 6 hours till the clotting time became normal. So the low dose will be the basis of low dose therapy is that venom is absorbed only gradually into the systemic circulation, and the low dose is sufficient to neutralize the absorbed quantity of venom. So the low dose is given over a longer period as absorption of venom continues into the systemic circulation. So what is the supportive treatment for this snake bite is analgesic for pain and antibiotics for the infection, and the choice should cover the anaerobic infection and anti-tetanus prophylaxis and replacement of coagulation factors like platelets. If there is an active significant bleeding or bleeding into the vital organs, we can go for the coagulation or the platelet replacement. So next is the management of the complication. So in case patient is having the respiratory failure because of the snake bite, we can go for the hydroquinone or the atropine 10 mg or 0.6 mg as a test dose. And next will be the neostigmine or the atropine 0.5 mg or 0.6 mg every 30 to 60 minutes. And we can administer and move for the mechanical ventilation. And in case patient having the shock, we should treat as appropriate treatment. And in case patient with renal failure, we can go for the dialysis. And tight tourniquets are not recommended. So in case of patient with snake bite, we should not do the tight tourniquets. Okay, so to be effective, these had to be applied around the upper part of the limb, so tightly that the peripheral pulse was occluded. So this method was extremely painful and very dangerous if the tourniquet was left on for too long, that is more than about 40 minutes, as the limb might be damaged by the ischemia, that is a dangerous gangrenous limbs. So confining these toxins in a smaller area by use of compression techniques creates a greater risk of serious local damage. So we should not do the tight tourniquets, that is the tight pressure over the snake bite area. So why we should not do this tight tourniquets over the affected area is when the tourniquets are removed, there is a problem of venom rapidly entering the system and causing the respiratory failure in the case of neurotoxic bites. So the Russell Viper's venom contains the procoagulant enzymes which causes the blood to clot. So in the small space below the tourniquet, the venom has a greater chance of causing a clot. So when the tourniquet is released, the clot will rapidly enter into the body and it can cause the embolism and also the death. It was given by the Kevin Laurier by the year 2014. So according to this statement, we should not do the tight pressure or the tight tourniquet over the affected area. So it should not be done. So lastly, there has been a great deal of research showing that the tourniquets do not stop venom from entering into the body. So what is the nursing diagnosis for the overall poisoning is first diagnosis will be the ineffective breathing pattern related to swelling of the nasal mucosa wall as evidenced by shortness of breath with the lips, the rhinitis. So second diagnosis will be acute pain related to gastric irritation as evidenced by abdominal pain, looked grimacing while holding stomach. So third diagnosis will be impaired skin integrity related to changes in circulation as evidenced by swelling and itching of the skin and the nose. There are hives and also urticaria. So what is the assessment part is to assess the patient's condition and monitor the patient's condition, assess the type of poisoning, what type of poisoning it will be. And third will be to assess the more injured area. So what is the nursing goal to save the life of the patient is to early detection, early management and prevention of complications. So what is the interventions for the poisoning? So first will be the first diagnosis will be the ineffective breathing pattern related to swelling of the respiratory mucosa wall. So what is the intervention? Nursing intervention is assess the respiratory rate and what is the depth of the respiratory rate which should monitor. And second thing is to maintain the patency of the airway. So that is very important. And do the intubation in case of laryngeal edema or laryngeal spasm and give the comfortable position to the patient to maintain the good breathing and remove the cause of the allergy and give anti-inflammatory drugs or the antidotes as prescribed by the doctors. And second nursing diagnosis is acute pain related to gastric irritation. So what are the nursing interventions for this diagnosis is to first observe or assess the characteristics of the pain. So what is the site and what is the level of pain? What is the characteristics we should monitor? And stop the patient from the eating and keep patient on NPO, give IV fluids and give activated charcoal and cathartics as prescribed by the doctors. And third nursing diagnosis is impaired skin integrity related to changes in circulation. So what are the nursing interventions for this nursing diagnosis is assess the skin condition and prevent the patient from the exposure, wash the exposed area thoroughly with water, do the aseptic dressing and apply the antibiotic ointment as prescribed by the doctors. So let me see the conclusion of this poisoning is thousands of deaths takes place every year because of intentional poisoning among adults and unintentional among the children in our state. So many snake bites and even deaths from the snake bite are not recorded. So one reason is that many snake bite victims are treated not in hospital but by traditional healers. Some people who are bitten by snakes or suspect or imagine that they have been bitten may develop quite striking symptoms and signs even when no venom has been injected. So this results from an understandable fear of the consequences of the real venomous bite. So still now we have seen definition and epidemiology, what is the pathophysiology, what is the signs and symptoms, and what are the first aid management, and what is the medical management, what are the pharmacological and non-pharmacological management for the poisoning, and also the nursing management includes the nursing diagnosis and what are the nursing interventions for each nursing diagnosis we have seen. So thank you.